Hello and welcome to Tigovat YouTube channel. My name is Tanya and I am the founder of Tigovat Green Tea Capsules here in Germany. And today my special guest is an American's top holistic endocrinologist and diabetic specialist. Dr. Zaidi, welcome to my channel.
Sure, I'm glad to be here.
Great. Dr. Zaidi, you're a former assistant clinical professor of medicine at the UCLA, and you're the author of several medically acclaimed books, including the book titled Power of Vitamin D.
Yes.
And this is why I invited you today, as I would like to learn more about the important vitamin from a specialist like yourself.
Thank you.
Dr. Zaidi, you started vitamin D levels in your patient, as you were starting testing it in your patient 15 years ago, and I was quite impressed.
Mm-hmm.
And you have discovered that 90% of your patients had a deficiency.
Yes.
And your patients were mainly living in the Southern California, so with a healthy outdoor living.
Yes.
And this is very strange because in your professional opinion, why did you still have a vitamin D deficiency? And why was the sun exposure not enough?
Well, let's step back and look at how do you form vitamin D. So vitamin D, we call it sunshine vitamin because sun is the main natural source of vitamin D. So when sun rays, especially ultraviolet D rays, strike the naked skin, then vitamin D synthesis starts. But if you wear clothes, then this process of vitamin D synthesis is interfered by about 50%. Similarly, when you put sunscreen on, anything more than SPF 8 really blocks all vitamin D synthesis completely. So these people were going out, and of course, when we go out, we are covered with our clothing, and a few exposed parts of our skin, like face or forearm, we make sure that we put a lot of sunscreen, right?
Yes.
So by having clothing and having sunscreen on, these people, they were thinking that they are outdoors and they are making a lot of vitamin D, but in fact they were not, because of clothing and because of
the sunscreen.
And most people apply sunscreen, which is more than 8 SPF. And a third reason was that these people were also taking the usual recommended dose of vitamin D, which is about 600 IU per day. And despite that recommended dose of vitamin D, their vitamin D level was low. So here is hard clinical data treating thousands of patients, and they were doing what we physicians have been recommending: go outdoors 15 minutes a day. Actually, these people were outdoors more than an hour a day because they were living usual Southern California, healthy lifestyle, going outdoors, playing tennis, playing golf, hiking, all those things. And also taking recommended dose of vitamin D, and still their vitamin D level was low. So I was surprised myself.
Okay, yeah, this is also surprising me. And after treating thousands of people with vitamin D deficiency, what did you find is the best treatment option?
Okay, so back 15 years ago, I was kind of like, first I was totally surprised, shocked. Then I started adding vitamin D supplements in increases doses. So from 600 IU, I went to 1000 IU, then 2000 IU per day, and gradually kept increasing. I also had this opportunity of seeing these patients every 3 months for their ongoing health issues. So I was checking their calcium level, their vitamin D level, overall blood chemistry and everything, and also, of course, checking how their health is doing. So, and I kept doing that, over years, thousands of patients. So this is what I found out. And here's my formula. Vitamin D supplement is the best practical way of getting your vitamin D level into the optimal range, which is 50 to 100 nanogram per ml. And the formula is 5,000 IU for every 45 kg body weight.
5,000. Wow.
5,000 IU for every 45 kilogram of body weight. So if you weigh 90 kilograms,
yes,
you need 10,000 IU per day.
Wow, this is amazing.
Yes. And most of my patients, they were on these doses. And that's the only way I saw their vitamin D level getting into the optimal range.
Wow, this is quite incredible. Thank you for this information.
Yes.
Because in Germany, we have like 800 per day. And still a lot of people are not rising their vitamin D level. So that's why,
because true.
Yeah.
And I will recommend that anybody who is interested in their vitamin D status, the best way is get your vitamin D level checked.
Yeah.
And they will be surprised. And this is what I've been doing. I will get their vitamin D level checked. And as I said, more than 90% of patients will turn out to be low in vitamin D. So if you are skeptical about it, then go ahead and have your vitamin D level checked.
No, I know. I have a very low one, even if I'm taking a lot of supplements daily, which is like, now I know because the vitamin D supplements maybe are too low. But a lot of times I heard, for example, vitamin D toxicity. I mean, if you're starting with 10,000 units, somebody will say, oh my God, no, it's a vitamin D toxicity. You can be damaged with the vitamin D. What can you tell me about it? Did it ever happen?
Well, in treating thousands of patients over 15 years, I have not seen a single case of vitamin D toxicity. And most of my patients, they have been taking vitamin D according to the formula I just said. And most of them have been taking vitamin D something between 5,000 to 20,000 units per day for months and months, and not a single case of vitamin D toxicity. So in literature, there are a handful cases of vitamin D toxicity described, and I looked at all of them and I reviewed them. And in each one of those cases, they were taking vitamin D more than 80,000 units per day for several weeks. Okay?
Yes.
So that kind of dose, if you take for several weeks, can potentially cause vitamin D toxicity. And there was also a wonderful review from Canada. And the researchers concluded that vitamin D toxicity starts at a level more than 300 nanogram per ml.
Okay. Yes.
And here we are talking a level between 50 and 100 nanogram per ml. So you can understand the big difference.
Yes.
So yeah, it's a myth. It's I will say ignorance.
Yes.
There is extremely rare cases of vitamin D toxicity, and I've never seen it in any one of my patients.
Okay, this is great. This is great for the myth, what you are having, what you were telling, because people are afraid to take more vitamin D in a higher level.
Yes.
because they are afraid of the toxicity, but you explained it very well. Thank you so much.
Oh,
And
you're
Dr.
welcome.
Zaidi, how does vitamin D strengthen our immune system and help us to fight against viruses? This is now a very special time with the pandemic, and I think we need some natural supplements, and I think vitamin D has a really impact in our immune system. And how does it fight it? How can it support us?
Okay, so there are several components of immune cells.
Yes.
Some help us to fight off the virus, and some causes inflammation. And the interesting part is this: vitamin D regulates all components of immune system.
Okay.
So there is a natural substance that is produced by the immune cells, and it's called CAMP, C-A-M-P.
CAM.
Which stands for cathelicidin antimicrobial peptide. So think of it as a natural antiviral agent. So by producing this chemical, immune cells are able to kill viruses, bacteria, fungi. Okay. Now, vitamin D helps to boost the production of CAM. In this way, it helps to kill viruses, including common cold virus, influenza virus, and coronavirus. And here is even more interesting part, that vitamin D also regulates the part of immune system that can cause too much inflammation. So, and that is called cytokine storm, which is basically too much inflammation. And vitamin D down-regulates that in such a way that immune system doesn't get into this cytokine storm. So vitamin D helps us to fight off infection, and it also helps to prevent cytokine storm. Now, as you're probably aware, that most people with COVID-19, they die from cytokine storm.
Yes.
Vitamin D helps to prevent it.
Yes. And there was an interesting study now. It's a new study that looked up 216 people with COVID-19, found that 80% didn't have an adequate level of vitamin D in their blood. The study also found that people who had both COVID-19 and lower vitamin D levels also had a higher number of inflammatory markers such as ferritin, which have been linked to a pure COVID outcomes. What is your expert opinion on that topic?
Yeah, exactly as I mentioned, that most people with COVID-19, they die from cytokine storm, which is basically excessive inflammation, and inflammatory markers like ferritin, D-dimers, those are elevated. They're just telling that there is too much inflammation, and that we also call it cytokine storm. And that is one major reason why people with COVID-19 who are hospitalized in the ICU, they die from this process. And so to me, I mean, it's just confirming what I'm saying, that when your vitamin D helps to prevent the cytokine storm, this pro-inflammatory state.
Yeah.
And when you're low in vitamin D, then obviously you are at high risk of having cytokine storm. So it doesn't surprise me at all.
Yeah.
And in this study, there were more than 80% people who were low in vitamin D, and it doesn't surprise me at all. It's totally in line with what I've been observing in my patients.
It's quite amazing, yes. So you would recommend now how we can protect ourselves not to get an infection to take your doses of vitamin D, like 5,000 units. What do you would say? What is the best the supplements like capsules, or in Germany we have it like in oil, or what you would recommend to the patients?
It really doesn't matter.
It doesn't matter, right?
It doesn't matter, yes. And
okay.
It's available in various forms. And as long as you take 5,000 IU for every 45 kilogram body weight. And there is some theoretical consideration that you should take it along with vitamin K2.
Yes, correct.
Yes. And the reason is this is pure theoretical consideration that vitamin D and vitamin K2, they actually work together in the body. So you amplify all these good effects. At the same time, there's theoretical consideration that too much vitamin D may cause some calcium deposits in the blood vessel wall, and vitamin K2 prevents that.
Yes, correct.
So if you want to be 100% safe, then you can take the supplement, and there are a lot of supplements available where there's vitamin D3 along with vitamin K2. And the usual dose, look for the dose where vitamin D3 is 5,000 IU, and vitamin K2 is about 100 to 200 micrograms.
Okay, great. Okay, and last question. What would you say is an ideal vitamin D level?
Okay.
In the blood.
Very interesting. Yes, I'm glad you asked that. So, vitamin D deficiency is linked with so many diseases. Because vitamin D actually is not a vitamin, it's a hormone. Our own body produces it because by definition, vitamins are something that our body cannot produce. We have to ingest it in the form of food. Whereas hormone is something that our body produces. So vitamin D is a misnomer. It's a hormone. It should be called hormone D.
Okay? Yes. Yes.
So, having said that, this hormone D has effect on every cell in the body. Okay? And there are numerous studies, which have linked low vitamin D to a long list of medical problems that you can have. Poor immune system, increased risk of autoimmune disorders, increased risk of diabetes, cardiovascular disease, and cancer, especially breast and colon cancer. Okay? So it's extremely important that you get your vitamin D into the optimal range.
Yes.
Now, the optimal range is interesting.
Yes.
Now, it depends what you are looking for. So if you are just looking to improve the health of your bones, then a level more than 30 nanograms per ml is enough.
Okay.
But if you are looking at all these other benefits, like benefit on your immune system and benefit, to fight off cancer and autoimmune diseases, then you need an optimal level, which is more than 50 nanograms per ml. So in my patients, I establish this optimal level, which is 50 to 100 nanograms per ml. And I found this level to be very effective in dealing with and preventing autoimmune disorders and boosting the immune system, and hopefully also preventing cancer.
Yes.
So that's the optimal level that I always shoot for, 50 to 100 nanograms per ml, which is also equal to 125 to 250 nanomole per liter in case you are using those terms. Okay.
So my one is too low.
Yes, and that's no surprise actually. And most of my patients, they will have their blood test done, when they come to see me first time. And they
Yes.
would be thinking their vitamin D is fine, and they will have the same comment, oh, my vitamin D is so low, I thought it was good. Yeah, so my really sincere recommendation to all the viewers is that please get your vitamin D
Yes.
level checked. It is a simple blood test, it is cheap, it's available
Yes.
everywhere, and this is one test that can give so much information about your immune system, your risk for having cancer, your risk for having cardiovascular disease. I mean, with just one simple blood test, you can really reap the benefits of vitamin D. And for that, you have to have a good level of vitamin D. And don't worry about vitamin D toxicity unless you start taking more
No.
than 1,000 units a day.
You explained it so amazing, you know, and you made this wonderful vitamin or hormone so you explained it in such a nice way. You gave me so much information, and even my viewers, they will see it, you know.
Yeah.
Dr. Zaidi, thank you so much for your contribution to the medicine, and especially for your patient and the vitamin D. You know, this is a really, really important topic, and now, especially in this time, you give us so much information. And thank you so much for your time. And I hope that I'm gonna talk to you soon again. Thank you so much.
Sure, you're welcome. Thank you very much.